I am María González, physiotherapist and expert in non-invasive neuromodulation. I am going to tell you about a fibromyalgia case, one of those that we find in consultation. And this one is curious because we had rapid improvement in symptoms such as pain, fatigue, and quality of sleep with central treatments. The patient comes to our clinic with pain and fatigue as the main symptoms of discomfort. And as we ask her, she tells us that she also feels that her quality of life is not good. At this point, we decided to treat her with Nesa microcurrents because of this need to neuromodulate her autonomic nervous system. And the patient, after understanding what we are telling her, what the treatment is about, the relevance of doing those continuous sessions, and knowing that she has to be an active part of the treatment, she agrees to receive this treatment. We set the objectives. In this case, they are very simple. As primary ones, pain and fatigue. As secondary one, improvement in sleep quality. And we decided to carry out some tests. In this case, we make a cardio, where we want to obtain information on heart rate variability and data such as SDNN or RMSSD. We also decided to carry out a modified Borg scale because of her feeling of fatigue. Also in SF-36 to assess quality of life and a Pittsburgh Sleep Quality Questionnaire. As an extra, we carry out a Latinan test for that generalized pain, since she tells us that she's been suffering from that pain for a long time and we consider it to be part of chronic pain. The patient agrees to this treatment, which we decided to carry it out twice per week for the first 3 weeks, then once a week the rest of the consecutive weeks, until we achieve our objectives. And we started our treatment. For her first session, we put a program 1 and a program 7 in central mode. I anticipate that the entire treatment with this patient will be performed with the directional electrode placed at the central level. So, we go with that program 1 and 7, the first 2 sessions, and little by little. In the third session, we tried to maintain program 1, since it is about fibromyalgia and we like to keep the hormesis program 1 for more sessions than usual, but we reduce its duration. Therefore, we now move on to making a program 1 for 15 minutes. We give more relevance to program 7 for the adaptation of that autonomic nervous system, and we want to begin to influence on the central nervous system with program 8 that will help us to address part of her anxiety along with program 7 and that cognitive part that we know will be good for her. The surprise is that after such a long time suffering and with a diagnosis made many years ago, in the 5th session, the patient is feeling improvement with programs 1, 7, and 8 in all 3 objectives we had: pain, fatigue, and sleep quality. That is why we decided to continue with this very basic guideline. We gradually eliminate program 1 and dedicate the treatment time between program 7 and program 8. At the end of the 10 sessions, the patient feels an important improvement in her quality of life, but we want to evaluate it, and we obtain changes. In the cardio, heart rate variability has changed from 25 to 49. It is very significant. In the SDNN, we know this is the metabolic flexibility, metabolic stress. It has also improved from 25 to 49. We already know that in the cardio these values are common. And RMSSD, which gives us information on vagal tone, from 41 to 53. It is already closer to the vagal tone values that we consider to be normal. Regarding the quality of life test, the patient has improved substantially from 36 to 82. It is quite surprising for the few sessions she received in a process that we consider to be chronic, such as fibromyalgia. Latinan's scale for chronic pain will improve by 11 points, from 15 to 4, and the modified Borg scale, which will give us information about fatigue, from 8 to 2. With respect to anxiety, with a GAD-7, which I had not mentioned it before, she also improves from 11 to 3. That is why, after completing these 10 sessions, we decided, always with the patient, that she should continue on a maintenance treatment, where we are going to space out this session sequence and where we will, in this case, try to maintain the improvement that she has already achieved to help her nervous system to be adapted. That is why, with this case, I want to tell you that many times, even if we consider that we are facing complex cases or diseases that are already established or perhaps long-term diseases, we are often surprised because with the simplest treatments, in this case only with 3 programs and with a central treatment, we have been able to neuromodulate and produce benefits in the patient much earlier than expected. That's why it's important to make as simple as possible those things that seem complicated, because we are going to be surprised of the scope of doing it in a simpler way. Thank you for listening to this case report that I wanted to share. I hope you find it useful.